Thank you so much for joining us. I have Dr. Ter-Petrosyan with us, a clinical psychologist with PIH. So thank you so much for joining us, and I'm gonna let her talk and do our presentation for us tonight.
Thank you for having me, and thank you everybody for joining. Today's discussion will focus on mental health and COVID-19. So today, I'm hoping this can be somewhat of an interactive presentation. I'll be giving an overview of stress and anxiety, followed by some coping tools that hopefully everybody can benefit from and apply to their day-to-day lives. Ooh, let's see. So let's just begin with stress overview. So, this word is familiar to all of us. We've all been stressed at, various points in our lives, but what exactly is stress? So I want to spend some time talking about stress, and then the next slide will differentiate the difference between stress and anxiety. Sometimes these two terms get used interchangeably, but in reality, they don't mean the exact same thing. So in terms of stress, stress is a process by which we perceive and respond to a stressor. And a stressor is a stress-provoking stimuli or a situation. So all of us are faced with various different stressors throughout our day. So that can be things from traffic in the morning on our commute to work, different stressors that we are faced with on our jobs, different stressors whenever we are at home, attending to family members, and things like grocery shopping. Everything essentially can be a stressor, and stress is essentially the process by which we respond to all of these demands in the environment. Stress tends to be our bodily response to stress, change, or some kind of a threat that we are seeing in the environment. As a result of stress, we also have some, cognitive changes. For example, we might have thoughts like, this is overwhelming, I can't do this, and so on and so forth. Stress can be acute or chronic. So acute stress is, in the moment, something is happening. Let's say you have a big deadline at work that you need to meet, and that would be considered acute stress, because once it's resolved, you kind of go back to your regular work schedule, and you're not really as stressed as work. As opposed to chronic stress, that's an environment in which the same stressor is repeating itself over and over again, and it maintains our heightened stress response. So for example, if you are, I keep bringing work examples because that's something I feel like everybody can relate to, but if, let's say, you work a job that is chronically stressful, so there's a constant demand on you. It's not just, like a deadline once a month or once every couple of months, but every day you're at work, you're experiencing stressors in the environment, a lot of demands, and that tends to lead to chronic stress. So chronic stress is stress that is maintained for a prolonged period of time. It can be days, months, and for some people, chronic stress can last for years. So again, important to keep in mind, stress, that's something that's happening in the here and now as a response to some environmental or external source. So responses to stress, like I said, we tend to have physiological changes. So if you think back to a situation in which you've experienced some kind of a stress reaction, we have an increase in heart rate. Some people have headaches. There are GI problems like nausea or stomach pain and more. We have cognitive changes, so that's our thinking. So that might be difficulty concentrating. So whenever we are stressed, that actually reduces our ability to pay attention to things, make decisions, and concentrate on different tasks that we have going on. And then we also see behavioral changes as a response to stress. So that can be unhealthy eating. Unhealthy eating tends to be a common one. People, tend to snack a little more whenever they are stressed, and, snacking on more unhealthy foods. So, choosing maybe bag of chips as opposed to carrots and so on. There are sleep changes that we see. So people who are undergoing stress have a difficult time falling asleep and a difficult time staying asleep. So what that means is they might report waking up several times throughout the night and kind of having that cycle continue. Increased substance use is also a behavioral response to stress. If people who are undergoing either acute stress or chronic stress, they might find themselves, when you get home, you might feel like you need that glass of wine or that beer, and kind of, going towards that, or needing an extra cigarette break throughout the day. So we respond to stress with a combination of all of these factors. It's not just one or the other. Some people have more of the physiological symptoms, other people have more of the cognitive symptoms, but typically it tends to be a combination of all of these. These responses to stress are not isolated in terms of their categories. In terms of anxiety, so stress versus anxiety, like I said, these two terms tend to be used interchangeably, but they are not one and the same. So again, just going back to what stress means, it is our body's and cognitive behavioral response to a stressor or some kind of a threat. So it's important to keep in mind that whenever we talk about stress, this is due to some kind of an external factor, right? So traffic is an external factor. Having to go grocery shopping, having to, clean, take care of our families, having a deadline at work, those are all external cues, which is a bit different than anxiety. I have fear on there, which I'm going to skip for now and go straight to anxiety. Anxiety, on the other hand, is similar to stress, but it's different because the worried thoughts and the responses that we have are happening in the absence of a stressor. So again, stress is in response to like an active stressor that we have in the environment, whereas anxiety is occurring in the absence of a stressor. So for example, people might have worried thoughts about, maybe losing their jobs when that's not even a reality. Like they're doing fine at work, they haven't, there are no concerns, but they might have that persisting excessive worry about things that are not immediately present in their environment. Anxiety, while stress is in response to external cues, anxiety is in response to internal cues. Again, there's nothing really going on in the environment, but the person still has the worry. Anxiety tends to be future oriented, and stress tends to be oriented to our immediate stressors. And in terms of anxiety, the feeling that we feel does not necessarily match the situation. So, sure, we might have some kind of a work-related deadline coming up in a couple of months, but the response, the level, the severity, and the level of changes and stress that we feel when we are anxious is disproportionate to the situation or the threat. And fear is an interesting also concept, which is related to stress and anxiety, but it's a little different because fear is an emotion. It's not really a state of mind, and it's in response to a real or perceived imminent threat. So, for example, for a person who is afraid of spiders, having that spider in the room can cause this immediate emotional response. That is, that's fear and all the physical and cognitive changes associated with the fear. But again, the important differentiation between this is fear is in response to something that's happening right now in our immediate, vicinity. Stress is, again, something that's happening now, but it's more of an external situational factor. And anxiety is something that is internally driven, that is related to something that is out in the future and is not an immediate stress-provoking situation. So stress is not all bad, right? When we think of the word stress, we automatically have this reaction that, that's a feeling that we want to completely alleviate. But the reality is stress, a certain degree of stress is actually helpful for us. So I have this graph here. This is the Yerkes-Dodson law. And as you can see on the y-axis, which is this vertical line, is performance. And the x-axis, which is this horizontal line, is arousal. So just want to take a second and kind of go through this, what this bell-shaped curve really means here. So as you can see, whenever our arousal is, close to zero, our performance is also low. And on the other hand, when our arousal is very high, our performance also tends to be low. And as you can see, this middle spot where the graph peaks, this tends to be the optimal arousal or stress level that leads to optimal performance, right? So as you can see, whenever we're in a situation where we have some arousal, that leads to performing a bit better. So a good example of this is all of us have gone, let's say, through school. So if you think back to high school or college, in a situation in which you had some kind of an exam coming up, and if you had no stress about this exam at all, you were not worried at all, chances are you didn't study as much, right? And on the other hand, if you had so much stress regarding this specific exam, you might shut down and not study, but for a different reason. But this middle optimal level of stress actually is good for us. It gives us, stress releases cortisol, which kind of gets us a little energized. It kind of gets us moving. So it's important to have some stress for us to get the tasks done that we need to do. But at the same time, it's important to not allow stress to peak, because that will reduce performance as well. So there's this optimal level of stress that is actually healthy, that is needed, and evolutionarily speaking, it leads to survival, right? If you, again, let's say if you saw, going back to evolutionary points, if there was a threat out in the environment, let's say some kind of a predator was hunting us, if we didn't have that stress arousal, we probably wouldn't be inclined to run away and would not survive. So we need that little kick to get us going, but not too much to make us shut down. So anxiety, like I said, we all feel stressed, and a lot of us feel anxious, but anxiety in itself is not problematic, and it becomes problematic when the amount of worry and the worry thoughts become significant and overwhelming, up to the point that we're not able to control the worry. So they sort of consume all of our thoughts, our days, and so on. This also, anxiety that's problematic is associated with a lot of tension. So, people report having a lot of muscle tension, inability to sit still, kind of having this antsy feeling where no matter what they do, they can't really seem to get the sense of relaxation. There are physical symptoms associated with that. A lot of people report having GI concerns, diarrhea, lightheadedness, nausea, stomach pain, chest pain. So all kinds of physical changes happen in response to anxiety. A lot of cognitive changes, so a lot of negative self-talk, concentration difficulties, memory difficulties, attentional problems, and most importantly, avoidance of common activities. When anxiety gets us to a point where we are no longer doing the activities that we typically would or need to, such as going to work, taking care of ourselves, our families, and all the different things around us, that is when it's considered to be problematic, when it negatively and significantly impacts our day-to-day functioning. So in terms of kind of going along with this idea of chronic stress and illness, don't really want to scare all of you with this, but just it's important to talk about this while we're talking about, chronic stress. And our minds and bodies are so interconnected, and one impacts the other all the time. So we have this group of conditions called the psychophysiological disorders, which are essentially physical disorders or diseases whose symptoms are brought out or worsened by stress and emotional factors. And when we say stress in this sense, I'm not talking about acute stress. This is more related to chronic stress. So for people who are under chronic severe stress, so for example, individuals who have chronic constant financial difficulties, or a stressful job, or a stressful home environment that, where there's abuse present and things like that, this sometimes can lead to having this cluster of psychophysiological disorders. So some examples of that. So on the left-hand side, you can see the type of disorder, and the right column gives specific examples. So cardiovascular conditions, gastrointestinal conditions, respiratory, musculoskeletal, and skin. I want to start with the example with the skin, because I feel like this is the one that tends to be pretty common, right? We've all been in a situation where, whether it was studying for an exam or we had a job interview or something that we considered to be stressful, and we've seen ourselves break out, right? We might get a pimple or two, and typically we know that is possibly most likely associated to the stress that we were feeling as a result of whatever was going on. Another example, again, going up the right-hand column. So for the musculoskeletal, tension headaches tend to be a very common response to chronic stress. Back pain or just joint pain in general, asthma and allergy for people who are under chronic stress. These conditions tend to get worsened because of the stress. Irritable bowel syndrome, like I said, GI issues tend to be a common symptom of anxiety and stress, but for people who have the chronic stress, this might, lead to developing IBS. Cardiovascular, hypertension, coronary heart disease, and heart attacks tend to increase as a result of chronic stress. So again, it's important to recognize chronic stress and find ways of addressing it, just to avoid the physical conditions as well. And in terms of the COVID-19 pandemic, this has been an interesting time for all of us. At least for me in my lifetime, I've never lived through a pandemic of this kind before. So this was really new for everybody, and it definitely has been an adjustment process for all of us. And all of us are and have been a bit more anxious now within the past year, right? We, thinking back of last year at this time, we didn't know what's going on, and there was a lot of anxiety, a lot of fear and stress associated with this pandemic. And that was okay, right? At the beginning, I remember going back to this Yerkes Dotson law, anxiety and stress is not all bad. Having that little stress is what led for all of us to be a little more cautious, right? If everybody was very, just nonchalant about the pandemic and didn't really have the stress response or feel a little anxious, they probably wouldn't really be wearing their masks and following the guidelines. And we're seeing this, right? Some people just, for whatever reason, either don't really believe in the pandemic, which is a different conversation, or don't really feel the stress response to COVID-19. So they might not wear the mask and follow guidelines. But for those individuals who feel that, little stress, that is kind of what drove everybody to follow the regulations, maintain social distancing, and wear the mask, wash our hands, sanitize, and so on. So common concerns that we have seen during the pandemic, and this is not an all-inclusive list. These are just common things. I'm sure there are things on here that some of you have felt and have seen with your friends and family members that I have not put on this slide. But one of the most common ones that tends to be very anxiety-provoking is uncertainty. Like, we didn't know what's going on. In some cases, we still don't, right? There is some improvement with the vaccine and some of the restrictions being lifted, but we still don't really know what's going to happen a year or 2 years from now when it comes to this pandemic. Loss of routine, home life being disrupted, which kind of ties to the loss of routine. For people who had kids, that home life looks really different now. The kids are doing remote learning, so it's a whole different environment having children in the house as opposed to sending them to school in the morning. Fear of contamination and contaminating others. I feel like this is especially true for people who work in healthcare. So, a lot of nurses, especially at the beginning, I've heard stories of nurses having to rent hotel rooms for a couple of months because they were afraid of going home to not contaminate their family members. Especially kind of leading to the next point, if you are living or are interacting with people who are either at higher risk for due to their own condition or are older. Feeling the impact of fluctuating system or lack of information. Thankfully, I feel like we get information, but sometimes the information changes and doesn't really match, and that also can lead to stress, right? So not really, sometimes they were saying wear 2 masks, and then they said wear 1 mask, and that the misinformation and the lack of consistency can lead to some anxiety. and the impact of misinformation, which, we tend to see, not a lot, but it's common, especially if you follow the news on social media outlets and things like that. There tends to be some misinformation on there. And on the other hand, overload of information, right? Just if you're constantly refreshing the page and seeing the numbers of positive cases or the mortality rates and just constantly checking the news to see what's been going on, that information overload also can lead to anxiety. Loss of usual self-care activities. So not being able to go to the gym, not being able to go out, spending time with friends, spending time with family members, having to socially distance, which that in itself is not a bad thing because that is a guideline that we are all following. I'll talk a bit about what I mean social distancing in a couple of slides. Having special events canceled, if you had a wedding or some kind of an event planned that's been canceled, that some people have complained about that. Having to talk to kids about COVID-19, it's really hard conveying information to children that we ourselves don't really know as much about and are still learning and gathering. Microaggressions and racism, whatever's been happening with our Asian American and Pacific Islander communities has just been horrendous. And a lot of that has come out, as a result of COVID-19. And like I said, there's a lot more that we can put on here that, we can talk about if we had time. So just wanted to share some statistics with you in terms of anxiety. So this Kaiser Family Foundation, which is not associated with Kaiser Permanente, but they did a study where they surveyed households back in, I'll show you a couple points collected from this organization, but they administered anxiety questionnaires and depressive disorder questionnaires to household. And as you can see, in January of this year, in 2021, 41.1% of individuals surveyed endorsed having either an anxiety or depressive disorder symptom, whereas the NHIS rates for 2019 were only at 11%. As you can see, there is a big jump from what was going on from January to June of 2019 versus at the beginning of this year. For anxiety specifically, given that we're talking about anxiety, as you can see, this 41.1 was a combination of anxiety or depression. But they broke it down in this specific chart to isolate anxiety symptoms. And as you can see, of the people surveyed earlier this year, 35.8% of them had endorsed symptoms of anxiety. And that's a big chunk of individuals. And I don't have the slide on here, but there was another group that did a survey back between July and September of 2020 that specifically addressed healthcare workers. They surveyed about 1,200 healthcare providers, and of the 1,200, 93% of them endorsed stress within, at the time of this survey, which is an incredibly an unusual number. In terms of tracking some of the anxiety reported, so like I said, this the Kaiser Family Foundation has been tracking this since the beginning of the pandemic, so since April of last year. So as you can see, it was done in phases. So the anxiety symptoms reported, this graph is for California specifically. As you can see, it's been consistently high. It hasn't really dropped from 30%, but as you can see, it's sort of, even though it kind of, has the peaks and the declines, but on average, the anxiety has been increasing within the last couple of months compared to last year, right? Even though, I don't want to say we got used to the pandemic, but it's not as new as it was back in April, but still, regardless of the fact, we're still seeing increases in anxiety symptoms reported by adults living in California. This can be, there's obviously no one specific cause to this, but some things, can be just ongoing and extensive lockdowns and, businesses being shut down. So numerous causes, we can attribute the anxiety symptoms to, but again, just important to look at the trends and see what's been going on. And this spike right here is, I feel like this is the one associated with the second wave that we got back in July and had to go back to quarantine. So helpful data to see. So with all of that said, so how do we cope with stress and anxiety? So the California Surgeon General, they released this helpful wheel, which they call the Stress Buster. And they essentially highlight 6 areas or aspects of our lives that they recommend addressing to help relieve some stress. So balanced nutrition, mindfulness practices, so that can be anything from meditation to prayer, physical activity, focusing on sleep, focusing on fostering and building supportive relationships, and then lastly, mental health care. And obviously all of the 5 kind of lead to and are tied to the mental health care. But sometimes for certain individuals in certain instances, it's helpful to have a mental health provider. Not everybody needs a psychologist or some kind of a mental health provider, but some people do in certain situations. So one of the key things is normalization and, and just realizing that you're not alone in this. Even just looking at the statistics, like almost half of the state is experiencing some kind of anxiety. Recognizing that some things that we are going through are out of our control, and that's okay, right? It's hard to give up the control. It's hard to kind of sit back and let life happen, but especially when it comes to this pandemic, that has been a struggle for many, but in some ways it helps, it functions as a really helpful coping tool. So just recognizing that we can't control everything, which kind of leads to this idea of radical acceptance, which, radical acceptance does not mean approval, right? We don't have to approve or or be okay with what's going on, but accepting the fact that we can't change the situation, or, we can't control every aspect of it. And having negative reactions is also okay. It's okay to recognize that you feel upset or stressed, or sad as a result of what's going on. Connecting with self is a big one too. So having daily or hourly check-ins with yourself to see how you're doing, kind of pausing and checking your body to see if, is there more stress that you are feeling in your body? Are you having a headache possibly that can be related to the chronic stress or anxiety you are experiencing as a result of this? Trying to monitor the stress. So are you having physical and emotional changes, right? Do you feel like you're being a bit more distant with your coworkers or your family members? Are you resorting to those more of the negative coping mechanisms or behavioral changes, such as increase in substance use or increase in binge eating or unhealthy eating? And having some self-compassion, when it comes to relationships, children, work, where everyone is gradually and, trying to adjust and adapt. If you're having trouble with, helping your children through their remote learning from home, that's okay. Most of us, or at least, for myself, I'm not a teacher. So it's hard having to help children at home, and it's okay to have some compassion for yourself for not remembering how to solve a specific math problem from middle school. And then again, in terms of work, so if you need the support, being able to recognize that and possibly ask for the support, whether it's if you have the option of working from home or taking a day off or taking a mental health day or whatever that may look like for you. Setting limits for yourself, and setting limits for others, right? So again, it's important to prioritize self-care and taking care of yourself before we're able to take care of other people, because unless we are doing okay, it's really hard for us to make sure that other people are doing okay. Your subjective concerns are important. And again, this is something that I've heard some of my patients say, I feel like I'm constantly complaining and, my job has been stressful and my spouse, doesn't really want to hear about it anymore. But that doesn't take away from the subjective reality or or the reality and the subjective experience you are having with whatever stressful situation is as a result of this pandemic. Recognizing that you are doing the best that you can, again, given the situation. Most of us have not lived through a pandemic before. This is something brand new to almost everybody, and it's okay to not know what to do, and also recognize that you are doing the best that you can given the resources that have been provided to you. Connecting with others. I put social distancing, if you recall, in the, some of the concerns that are coming as a result of COVID-19. And I said that social distancing in of itself is not problematic. We're supposed to be social distancing to minimize the spread of the virus. But this social distancing idea kind of got interchangeably used with isolating, right? When we say social distancing, that does not necessarily mean isolating. And especially at the beginning of the pandemic, I feel like that's what it really translated to. So, so what is social distancing versus isolation? So social distancing is within the social distancing guidelines. We still are able to socialize and interact with other people as long as we are, maintaining distancing, wearing our masks, and, sanitizing and being safe. Whereas isolating is completely eliminating all social contact, whether in person or over the phone. And that has been one of the problems that, some people have faced, of not really finding their groove of what it means to still be able to visit friends and family members in a safe manner while social distancing, as opposed to just completely giving up and isolating. And many people have been isolating. So it's important to be mindful of your behaviors and what this social distancing has meant for you. So are you social distancing or are you isolating? Because isolation can lead to various negative effects. And which kind of leads me to this slide, right? So I have this picture at the bottom where you see that's a great example of people who are interacting and spending quality time while also socially distancing. They're pretty spread apart. They're not wearing masks, which, of course, you can, but they are still able to have and maintain some aspect of their social life while also being safe. So connect with the people that you love. Whether if going to see people is not an option, let's say if you have a family member who is a bit older or has, pre-existing conditions that you're afraid to see, call them over, FaceTime, Zoom, whatever platform you have. Talk to people on the phone, connect with your coworkers and neighbors, express yourself, especially with coworkers. If you're in a field where, things are a bit stressful, everyone is in the same boat as you. So, having that coworker support is really helpful. Be mindful of how your anxiety is impacting other people, right? Especially children. It's okay to acknowledge your fear to others, including your kids, right? So, if, again, it's difficult having these conversations with the little ones, but it's also, kids are smart. They know what's going on. So it's not necessarily helpful saying, no, everything is great, everything is fine, because they know it's not fine. They of course see the change. So it's important to acknowledge the fact that there are some things that are changing, and there's some fear involved and some uncertainty, but these are ways that we are dealing with this as a community, as a family, and so on. And making sure that we monitor our anxiety and how they can impact how we connect and interact with other people. Taking care of your body. This is a big one, and it's an important one, and for many people it's a difficult one. So, eating habits, like I said, in situations where chronic stress is present, our eating habits tend to change for the worse, right? So, we're not really snacking in a healthy way, or we're not eating mindfully, which means that we might be overeating, past the point where we feel full. For many people, going to the gym has been a great source of self-care, of mental self-care and physical self-care, which now the gyms are reopening, but for a long time gyms were closed and people had a difficult time reestablishing that exercise routine. So getting used to running outside as opposed to on a treadmill at the gym. So learning to reestablish the exercise routines, whatever that may look like. Thankfully we live in Southern California and we have a lot of hiking trails. So maybe finding a new hiking trail that you enjoy, or, maybe investing in a bike or something like that. Helping improve sleep. Again, sleep is a big one that gets impacted with stress. So, having some kind of a routine before you sleep. So whether it's drinking some kind of decaffeinated tea, or, reading a book, and, kind of cueing our mind and body that, we're approaching the time to sleep. Reducing substance intake. Like I had mentioned earlier, in stressful situations, people sometimes overuse substances, whether it's nicotine or marijuana or alcohol. So being mindful of that, allowing yourself to rest, and also hydrating. So again, taking care. Remember earlier I said our minds and our bodies are so interconnected. So one good way of us to take care of our mind is to take care of our body. So all of these things will help you feel better emotionally, will help with attention and, many other symptoms that might be going on. And taking care of our minds, right? So self-care is a big one. I feel like it's a word that gets used often, but doesn't really get implemented as often. It's hard to actually stick to a self-care routine or find something that we really enjoy and do it on a consistent basis. So self-care can look in a lot of different ways. So taking breaks as much as you can. Even it doesn't have to be an hour break or a 30-minute break. Even if it's a 2-minute break where you can just, just shake things off, tune out, maybe put on a song that typically puts you in a good mood. So, keeping headphones with you just so you can, during your break or taking a walk around the building and just listening to a song to kind of change your mindset a bit. Watching a funny sitcom, or, finding some kind of a personal hobby. And again, this kind of ties back to the idea that a lot of us are not engaging in some of these self-care activities because some of our, places where we would typically go for self-care might be closed. So maybe finding ways of implementing some hobbies at home or learning a new hobby or, along those lines. Starting a new project around the house. So this has, one of the perks of COVID-19 is that being home has allowed many people to get some things done that they've been putting off. So actually making yourself do that project or, clean the garage or, repot some of the plants that you need or whatever that you feel like needed to get done around the house. Just do anything to take care of yourself, your environment, to give you the ability to sort of not tune out, but just kind of mute some of the anxiety and the distractions that are causing some of the stress and refocus your mind on something that is pleasurable to you. Mindfulness and meditation have been a big one. There are a lot of mindfulness and meditation apps. One of the more common popular ones, it's a free app, it's called Calm, so CALM. It's a really good tool. I have it on my phone. I recommend this to my patients. It has some guided mindfulness activities. It also has a lot of sounds like rainforest and or fire that kind of tends to foster some relaxation. So I would highly recommend looking into it. Spiritual or faith-based practices. So again, churches were closed for a long time. But it's important if you are a spiritual person, reconnecting, away from the church. So, implementing some faith-based practices within your day, praying a little more than you typically do just because, if you can't attend mass and things like that. So I have this picture on here that says 50 ways to take a break. I know I talked about taking a break, and that is sort of an ambiguous thing because, some people don't really know what that can look like. And this has some ideas. So taking a bath, listening to music, taking a nap, this one, letting out a sigh, just kind of doing anything where you either have some kind of a physical release. Like I said, just if you want to get up and just shake yourself off or do a little stretch. Here it says, noticing your body. So if you have tension in your shoulders, kind of shrugging and letting go. If you have a pet, I know pet adoption has increased during COVID for a good reason. So, if you have a pet, just, spending time with your pets, doing some arts and crafts and putting on some music and dancing and reading poetry, journaling, and there's a lot of different ways where little breaks can be implemented throughout our day. The point of taking breaks is, whenever we reach a point where our anxiety or the stress response peaks, it's really hard to come down. It's a little easier to stop it from peaking. So again, once we get used to the idea of checking in with ourselves and our bodies to see what we're feeling, if we notice some of the common symptoms that may lead to stress, it's important to more helpful to pause that to make sure that the stress does not escalate, because it's a little more difficult coming down once we are at that peak level of anxiety. Changing your environment. So decluttering and cleaning tends to be really helpful. It gives us something to do, right? We are purposely focusing on something that's not COVID, and it's not the pandemic, and it's not the work environment, right? It's we're in the moment kind of focusing on cleaning our house and reorganizing the closet or whatever needs to be done. And just the idea of decluttering and just, having more of a minimalistic space tends to be helpful for our mental health. Implementing reasonable changes in the environment and avoiding unreasonable changes. So I just want to pause here at this point. So I have this picture here. So looking back at, some of the things that we were doing last year when we didn't really know much about COVID, in terms of, disinfecting every single thing that came into the house and, not touching packages. Like, I know I left my packages outside for several days just to kill whatever was on there before I brought them home. And as scientists learned more and more about COVID-19 and how it spreads, they learned some things like, it doesn't live on surfaces as long as they initially thought, and so on. So I'm not saying don't disinfect your, your groceries and things like that when you bring them home, but implement reasonable changes. Like, just adding that extra stress to yourself. And this kind of leads to this photo I have down here. Like, not every grocery shopping experience has to be this experience where you feel like you have to wear a hazmat suit and just bleach everything up and down. So disinfect, but making sure that it's not done to the point where that task in itself is leading and causing the anxiety and stress reaction. Identifying factors in our environment that are contributing to our stress, and either changing or eliminating them. So for example, if, I know I keep talking about traffic, right? So if, for example, this kind of ties back to seeking and asking for help. So if you have an option, I know some people who had the option of working from home and chose to still go to the office. But if there has come a point where you feel like, you really wish you could be working from home, that would really help eliminate some of your stress, changing that part of your environment, maybe asking your boss if it's possible to work from home, and something along those lines. While the loss of routine has been really stressful, a good way to tackle that is create a new routine. So whether it's a personal routine, routine with your family and children, right? So some people, they've kind of like lost a morning routine of sending people, dropping off the kids at work and picking them up and so on. But, you can create new routines throughout the day, new routines throughout your work. So trying to, if we can't do the things that we'd once did pre-pandemic, creating new ways of still having meaningful days that are not just kind of swamped with the anxious COVID thoughts. So doing more and more things, tying things that are pleasurable into our day-to-day activities and routines. So changing your environment. And while I said, social isolation is not helpful, right? I encouraged everybody to connect with people that they love, which at the same time, it's also important to be mindful of possibly disconnecting from other people, because the reality, not everyone in our life is going to be helpful. There are some people that we have, whether family members or friends or coworkers, that you might notice are inducing some of the stress reactions, right? So, if you have people in your life that you have or recently, have had more unhealthy relationships with, conversations with, let's say if you have a friend that all they want to talk about is COVID and, mortality rates, it's okay to disconnect from them and distance from them a little, or, have a conversation with them like, hey, next time when we speak, is it okay if we don't talk about COVID? So by disconnecting, I don't mean just stop being friends with people and cut them out of your life, but having those boundaries. If you continue to have stressful interactions with them, it's okay to let them know and, distance yourself a bit from them. Minimizing the news. This has been, again, this overload of information and, some misinformation has been very triggering for people. So, minimizing how much time you spend browsing the web or, reading the news or watching the news. If you're someone who's constantly, checking your LA Times app or however you get your news on your phone, our iPhones actually have a really helpful tool that allow us to monitor the screen time, and you actually are able to set a time limit where, you say, I want to spend 30 minutes combined throughout my day on these specific websites like CNN.com, Fox.com, or wherever you get your news, and your phone will actually remind you and say, you've been on these websites for 30 minutes today. And that's a good way to track how much time we're spending. And while it's important to minimize the news, it's important to not completely avoid the news, right? Because, being bombarded with information is not helpful, but being completely ignorant is also not helpful. So just making sure you consume the appropriate amount of news that can allow you to, make safe decisions about, it's important to know like what regulations are in place in terms of, if you can dine in or not and things like that. But again, not helpful to constantly refresh the page and to find like every single new COVID case and so on. Reducing social media exposure. Social media, in general, spending too much time on it outside of COVID, just in general, is tends to be, for some people, really harmful to their mental health, and especially when it comes to COVID, it tends to be sensationalized. Sometimes people do put misinformation, and there's a lot of clickbait information, meaning that they'll have a specific post just to attract people, but doesn't really have important or useful substance. So making sure that you are mindful of the information that you're consuming online. And minimizing searching symptoms on the web. I feel like a lot of us did this in the beginning where we weren't really sure what COVID symptoms look like. Anytime there was a bodily change that we experienced, we might have turned to Google to see what's been going on and if it's COVID or if it's dangerous. And a lot of times Google doesn't have the best answers for us. So again, if you have some kind of a physical symptom and you're not sure where it is, I recommend checking in with your primary care doctor, your family doctor, and not really, relying on Google to diagnose, because, it's not really accurate, and that in itself can cause some anxiety. And lastly, seeking professional help. Like I said, stress and anxiety don't necessarily equate to having a mental health condition. Some stress is helpful. All of us feel stressed at one point in our lives, and it's okay to be stressed and have some anxiety. Having anxiety doesn't translate to having an anxiety disorder or a diagnosable and treatable mental health condition. Anxiety is one thing. A disorder or mental health disorder that's anxiety related is a whole different thing. And of the population, less than 10% actually go on to develop an anxiety disorder. But if you feel like your anxiety has been overwhelming, like I mentioned earlier, it's been getting in the way of your day-to-day functioning, you're not able to take care of yourself, your duties at home or at work, then that would be a good idea to maybe seek professional help to get a consultation to see what's going on, whether it's, some kind of an adjustment disorder, whether it's an anxiety disorder, depression, or whatever the case might be. I have some support lines on here. So there's a 24-hour suicide prevention lifeline, the 24-hour domestic violence hotline. Unfortunately, with COVID-19 and many people being isolated at home, this has increased the domestic violence rates. Right, people, for a lot of people, going to work or going to school has been some kind of an escape of sorts from a potentially abusive household, and some people have had to be at home with the perpetrator. So again, if you know somebody who needs support in terms of domestic violence, there's a hotline, and there's you can either speak to somebody, or there's a chat option if you feel more comfortable chatting. Another domestic violence hotline is the California Partnership to End Domestic Violence. There's a disaster distress hotline that is specific for COVID, because this is considered a disaster. Again, you can either call or text that number, talk with us to 66746. They provide 24/7 support. Again, another crisis text line, the Cal Hope Peer Line, Peer Run Warm Line. Again, this is for they're specifically focusing on COVID-19 specific non-emergency support. So again, if it's a suicide or some kind of medical emergency, this would not be the line to call. This is more just to get some extra support that is not considered an emergency. Another warm line that is California specific, and then lastly, the Beacon Health Strategies, which again, they offer use of telehealth to meet treatment needs during the coronavirus outbreak. So again, please share these with friends and family that you may think are in need of these support lines. And that brings us to the end of the presentation. If you have any questions or comments, please feel free to share in the chat box, and we can address them.
Thank you so much. One of the questions we got was, I have friends and family who are scared of going back to quote unquote normal. Mm-hmm. How would you suggest transitioning from being isolated to going back to normal?
So this kind of ties back to the idea of socially distancing versus socially isolating. And people have different reactions to COVID-19, and just like how I said, it's helpful to recognize your own reactions and what you need in the moment. It's also helpful to recognize the other people's reactions. We can't really control or change how people feel. So if this is someone that you're close with, it might be helpful to have a conversation with them about what it is about going back to quote unquote normal that's scaring them. Like maybe, for example, they might tell you that they don't feel safe around the specific person because of the job that they do, or they would like you to wear a mask if they see you, or sanitize and things like that. So maybe having the conversations of what would help them be more comfortable. And in the we can't force people to be comfortable. Like I said, this is so new to people, and everyone is having their own reaction to this and their own coping mechanism. And if for the time being, being a little socially distanced is how that individual is coping, it's okay to let it be for now, but also while trying to explore what it is that maybe you can offer to help minimize that. Like I said, if for example, like bringing up a personal example, I have friends who are still, very uncomfortable with seeing each other. So we kind of made an agreement that when we see each other, we're going to be socially distanced. I haven't hugged them in the last year, and every time I see them, I wear a mask. And that is, again, kind of, we met halfway in terms of what our comfort levels are. So maybe having that conversation and maybe fostering that comfort level a bit to make sure that that individual is heard, right? You're not rejecting or making them feel like they're wrong for not wanting to see you or go back to normal, while also understanding what maybe you can offer in the situation to help them put them a little more at ease. And, you know, in the meantime, like I said, getting connected with them, if not in person, but making sure that you talk to them as often as you find necessary, maybe seeing them over video, just so you're not losing that, so that the distancing is not leading to isolation. So you're not losing that connection with them while they kind of process their own reactions out.
Oh, thank you so much. That was so good. We really appreciate you coming on with us tonight.
Of course. Thank you so much for having me. And I know this is being recorded and some people will be watching this after the fact and don't have a chance to ask questions right now. So please feel free to share my email with them. If anything comes up, I'd be more than happy to get in touch with them and answer any of the questions that they may have.
It was very helpful and great ideas on taking breaks. Thank you.
Thank you so much, Doctor. Appreciate it.
Thank you. Thank you, everybody. Have a good evening.